we can't in good faith argue that this hospital tax will not cost people jobs, and their jobs in our communities. Hospitals are saying either we sell or we close or we lay off workers. And unfortunately, the most tenable of those options is to lay off employees. That's the reality. That's the reality. And that's not just the end of it, though. This doesn't just have an impact on unemployment and on jobs. This actually has an impact on access. Not just if a hospital goes out of business or sells out to a different concern. It has an impact on access when hospitals lay off employees. It has an impact on the level of care that patients receive when there are fewer clinicians to treat them within the hospital. Layoffs are inevitable. I've heard it from so many hospitals. I know we've all heard it from so many hospitals. It's an inevitability. It has a negative impact on access for patients to get into hospitals, and we often are excited and we drive access, and we're very concerned about it, and we've heard a number of bills throughout the session that promise an increase in access for patients to the medical system, yet this hospital tax does the exact opposite. We can't have it both ways. And the other interesting side effect of all of this is as we lose our small hospitals, our community hospitals that add so much value to the patients, we're actually left with our larger hospitals, our tertiary medical centers, our academic medical centers. And at the end of the day, the costs are higher in those facilities than they are in community hospitals. Our community hospitals do a very, very good job of keeping their costs down. They do that all the time. And in this case, we're punishing them for it. And we're going to feel a hit at the same time. Because as we know, Medicaid reimbursement in the state of Connecticut is based on a percentage of cost. It's based on a percentage of cost. So if we are left only with high-cost hospitals, what we will see is that we are paying out a higher reimbursement to the hospital system in the state of Connecticut. And at the end of the day, we're going to see a negative impact on the budget. This is of great concern. This is of great concern. And I'll leave it with this. If indeed it is the will of this legislature to implement a hospital tax, and it seems as though we're moving in that direction, one has to pause at the arbitrary nature in which it is being implemented. As I said before, this thing has changed 6 times. Hospitals have gone from being winners to losers. And this legislature and government in general typically isn't very good at picking winners and losers. If a hospital does well, let it do well. If a hospital doesn't do well, then it has problems. But we shouldn't be driving which hospitals succeed and which hospitals fail based upon whether or not we tax them or we don't, based upon whether they do well at the end of the day or they don't. And this isn't just about tax. We're talking about improving the economy. This is going to have an impact on unemployment. This is going to have an impact on patient access. And it is irresponsible, in my opinion, for us to go ahead and do this. I'm supremely concerned. And if your hospital in your community is one of the winners on this latest spreadsheet, watch out. Because I understand we're coming up with a new version. Hospital tax version 7, 7.0. And your hospital might not be a winner anymore in the next iteration, or the iteration after that, or the iteration after that. Who knows how many more we have left? There's another 5 weeks. So I urge caution to those legislators who think, well, my hospital is a winner. My hospital isn't a loser. By the time this thing is done, who knows who's going to be a winner and who's going to be a loser. And I think at the end of the day, the real losers are patients, because it's going to have an impact on access. And I thank the kind lady for the answers to my questions, and I thank the Chamber for their time.